Welcome, everyone. My name is Francesca Iacorto. I'm an advisory board member of the Pearson Centre. I'm also the Senior Director of Public Affairs at the National Airlines Council of Canada. As many of you will know, the Pearson Centre is a progressive centrist think tank that addresses the big economic and social challenges of the day. In that context, I'm pleased to welcome you to the 5th webinar on major policy issues related to COVID-19 and how they are affecting our society. Today, we will talk about seniors' care in Canada with a special focus on the crisis in long-term care. We've all heard about the issues over the years, during the COVID crisis, and most recently with the military reports last week. I also want to let you know this will be the beginning of the Pearson Centre's focus on this issue. We will be doing further study and engagement over the coming months, and we will be issuing a short report with recommendations this summer. I invite you to reach out to us if you're interested in working on this issue along with the Pearson Centre. I also want to take a moment to thank two sustaining sponsors without whose help these sessions would not be possible. They are Canada's Building Trades Unions and second, the International Association of Firefighters. Now back to the panel. We have three knowledgeable panelists who know and care about this field deeply, and I want to thank them very sincerely for taking time out of their busy schedules to be with us today. They are, first, Donna Duncan, who's the CEO of the Ontario Long-Term Care Association, which represents nearly 70% of Ontario's 630 long-term care homes located in communities across the province. Their members provide care and accommodation to more than 70,000 residents. Second, we have Vicki McKenna, who is the president of the Ontario Nurses Association. The ONA represents 60,000 registered nurses and allied health professionals working in hospitals, long-term care facilities, public health, community agencies, and industry in Ontario. And third, we have Iris Evans, who is a Pearson Centre board member. She's also a former Minister of Health and Wellness and Minister of Finance in Alberta. She's currently helping to raise funds for Seniors Lodge and has a strong interest in the societal responsibility to support vulnerable people. Our moderator today will be Andrew Cardozo, who of course is the president of the Pearson Centre, and Andrew also writes a weekly column for the Hale Times on various public policy issues. With respect to the format, the panel discussion will last about 40 minutes and then be followed by a Q&A session before we wrap up promptly at 3 p.m. Eastern Time. Please use the question box on your screen and we will get to as many questions as we can. This session is being recorded and will be posted on the Pearson YouTube channel later on this afternoon. So on that, I will turn things over to Andrew.
Thank you, Francesca, and thank you for providing the framework for our discussion today. I will just mention we've got two other webinars planned for next week. One is on tourism and travel, which will take place on June the 10th. The tourism travel industries, and the other is on racism and COVID. That will likely be on the 8th. We're just talking to various panelists, and we'll either have it on Monday or Friday of next week. So keep in touch with our website to participate in those sessions. So welcome, panelists. Let me start with Donna Duncan from the Ontario Long-Term Care Association, and the question I have for all of you is, we've all seen a fair amount what's happened in terms of seniors care since the COVID crisis began over 2 months ago. Let me ask each of you to share your observations about what's happening and what we've seen and what we've learned, and I'll start with you, Donna.
Great, thanks, Andrew, and it's a privilege to be able to join you today. So, you know, certainly this has been a tragic circumstance for us in long-term care, and as we looked around the globe and certainly watched from Ontario as we saw what was happening in other countries, we actually, I told the government of Ontario that we were facing a perfect storm in long-term care, and unfortunately that was the truth. We had significant critical staffing shortages in long-term care, and that's across the country, not just in Ontario. Aging infrastructure, homes with rooms that had 4 residents in them, 3 residents shared washrooms, suboptimal for infection control. Certainly, the governments around the world and in Canada prioritize hospitals over seniors care at the beginning of this. I would say that where we've certainly seen the greatest losses, and certainly in Ontario with over 626 homes, more than 80% of those homes did not go into outbreak. But where we did see significant and tragic loss, and where the Army was called to go in and help, these were homes that ended up in dire straits, and in large part because their staffing shortages were so critical to begin with, the age of the building, certainly the timing of their outbreaks, and whether they were an outbreak before COVID-19 arrived. Also, we've certainly looked at the geography. So were these homes in hotspots? And quite honestly, these homes were asking for help, and in some cases pleading for help, and help. It took a long time for help to come. And when it did, it came in the form of hospitals, came in the form of the military, who unveiled dire situations when they went in on May 15th. But what I would say that really is stark for us is where would we be if we had had the hospital surge in Canada and in Ontario? Where would our long-term care homes be? Because it wasn't until April 15th that the government of Ontario launched an action plan prioritizing long-term care for personal protective equipment, for testing, and for those extra human resources. And we saw that action plan and the help that has come in has really made a difference. I think that the challenge for us is this is the beginning of the pandemic, not the end. How do we get out ahead of this? How do we work together to fix it? But it's been very stark on the ground.
And do you feel that things have stabilized now that the Ontario government is more involved with that action plan?
I would argue yes. Certainly the prioritization for personal protective equipment, the support on infection prevention and control has been profoundly important. Certainly virtual supports as well, including with our nurses and care has been very important for us. And getting the support with hospitals and military and others for staff, but those are interim solutions for staffing. We have to figure out how we're going to manage on a go-forward basis rather than these band-aids, but it's working, but we have to find a way to keep moving and prioritizing long-term care for these things on a go-forward basis.
Yeah. Vicki McKenna, Ontario Nurses Association, talk to us about your perceptions, and also just to clarify, you represent more than just the RNs, is that right?
Primarily, first off, thank you very much for including me in that panel discussion today. It's wonderful to have the opportunity to discuss and to share our observations, my observations, but ours of the Nurses Association. Primarily, our membership is registered nurses. Over 90%, almost 95% are registered nurses, and we have registered practical nurses as well as nurse practitioners, and we have health professionals right across in different organizations, and all that had to do with labor jurisdictions and things over the years, but they are welcome, certainly, and a big part of our union, even if they are small. So we do have over almost 4,500 nurses that are working in long-term care facilities, both homes for the aged, for-profit, non-for-profit nursing homes, and certainly in home care as well, which I know we're going to touch on a little bit further on, as well as public health and industry and clinics. So we do represent a broad spectrum of nurses working in the system. So to start, I want to say that what we're experiencing and what we've experienced here in Ontario right from the very beginning has been tragic, as Donna said, but it's been horrific in many ways. And I do agree that staffing shortages have been an issue. But I also want to say that the tragedy is felt most certainly by the families and and by the residents in long-term care, and we want to express our thoughts to all of them, but the workers in Ontario, and people may not realize this, but we have over 4,000, as I said, workers that we represent, but almost half, bumped over half now of the healthcare workers that have been affected and that are ill from COVID-19 are in the long-term care sector. And that has hit particularly hard. And certainly we have had a nurse die from COVID-19 in Ontario as well, which has been certainly tragic for the family and the whole community of nursing in Ontario and across this country. It's a very, very difficult situation right now, but our primary job has been to do everything we can to protect the healthcare workers, the nurses, because when they're safe and they're protected, so are the residents, and that's the core of our work. The amount of infections and those that have died in long-term care is unacceptable, and I think that we all have a job to do to make sure that that never happens again. We do everything that we can in order to prevent anything like that from happening ever in the future, but we are in the midst of the COVID crisis here in Ontario. I know other provinces are experiencing different things. Their curves are coming down. Our numbers are still over 400 today. We still, over the weekend, still experienced a number of positive cases and continue to have hospitalizations and many, many people in our intensive care units and in our homes, and in the nursing homes in particular. But right from the beginning, the availability of personal protective equipment was a huge challenge, certainly right across the sector, but predominantly in long-term care is where we saw it the most. Staffing, as Donna said, continues to be an issue and will continue to be an issue unless we act to make that different. And also we have to ensure we have aging infrastructure, but there are a number of what we call administrative controls that weren't put in place that would have, we believe, prevented a number of the infections that we're experiencing here in Ontario. That's about cohorting, and that's about keeping the ill in physically different locations than those that are well. There's some things like that have happened in Ontario along with the Ministry of Labour inspections and the Ministry of Health inspections. There's a number of things that didn't play the part that they should have played. And I agree with Donna, the focus in Ontario began in the hospitals on strategy, absolutely. She and I were at those very beginning tables where the focus was, and the questions were asked, what about long-term care? It did come late. However, we had organizations that we know of that acted quickly and didn't wait for directives from government. They did things, many of our homes did things in the very early days in order to prevent infections coming into their facilities. So we do have a lot of challenges ahead of us, but we are certainly willing to and able and will be a part of the inquiry that comes forward in whatever shape that comes. But we are every day working to ensure that nurses are safe and that they're protected. And if they are, then we know that we are trying our very best to protect the residents, because it's really about Ontarians.
Yeah, can I just ask in terms of full-time or part-time, are most of your members full-time? We've seen well, please go ahead.
Yeah, no, Andrew, I understand. Yeah, the question, and this is a very important question, is about the full-time versus part-time ratios that currently exist in our staffing in long-term care facilities. And part-time is many of our members are part-time, and there's fewer full-time jobs. And that is a historic staffing pattern in long-term care, and it's one that's been carried over for more than a decade, I would say. And one of the main issues around retention in staffing, at least on the nurses side of it. And we have nurses who work in 2, 3, even 4 facilities in order to cobble together enough hours in order to sustain themselves and their families. And so that is a problem. And we know from the infection control side of it, having workers move from institution to institution is very much a problem around infection control. And this was an issue that that we raised and that was, discussed during the SARS. There were recommendations out of the SARS Commission. There have been recommendations around that and going forward for years now. And the staffing patterns have not changed in relation to that. And so that has been very much a difficult situation that put the staffing at shortages that Donna talked about. And there are strategies that would mitigate that, but many of those have come into play. The other situation, of course, is compensation and job security. And this is again the priority for other nurses across the healthcare sector is not there in long-term care, and that is really something that we've been battling for years now, in order to have nurses properly compensated and to have the health and welfare benefits that will retain them in the sector. Nurses who work in long-term care, and we've done lots and lots of polling and work with them over a number of years, but what they love the work. I mean, people work in a particular organization or a type of practice because it is their niche and it's where they love to be, but it's very difficult if they can't secure enough to sustain themselves and their families, and they do leave. And we lose them for all kinds of reasons, but that is one of the major reasons, is stability in their compensation and hours, so that they continue to do the work that they love.
Okay, thank you. Iris Evans, please share with us your perspectives. You've been a health minister and a finance minister. You trained as a nurse originally, and you've been, share with us your perspectives that you have also from an Alberta perspective.
Thank you, Andrew. Well, as a Canadian, I look at both Donna and Vicky with a tremendous pride that the healthcare sector has such strong professionals working in leadership positions. And I have to say, I look at the Prime Minister and the Premiers of Canada and the territories, all that leadership, and know that while we have struggled and suffered through this collaborative process, that we have resisted the impulse to become politically interactive in an unbecoming way. Let's just say I have been proud of Canadian leadership, because although we have disagreed on some fronts, we have respected each other's views. I have also shared with you the compassion and passion and a sense of loss and sadness, especially with the military report, about those facilities that have, in fact, had less than a stellar delivery of care to those residents. There's no other way to say it. And so right now, when I look at things like that, I think of the 7 dimensions of wellness, and think that one of the sorrows for the people that lost their families and lost their loved ones is that the emotional, intellectual, and spiritual social delivery was once again gifted to the staff that were their only contacts really for many of them. And so the families felt this isolation, the residents felt isolation. And in the future, when we're challenged to a new template, we'll have to look at those kinds of things. I think too that the staffing issues, I have always felt where you have part-time workers that go between facilities, you're probably not getting the best of their energies on all times of day, because they've got so many other things along with their lives at home. And so those things have to be looked at. And I know that there's been an effort with the leadership in the provincials departments to try and address that. But a good part of our challenge has been the data sharing. It has been very difficult to understand that we don't always know the data behind the worker's name or the worker's payroll number. And those things are important to know. We have to have a better understanding of that data sharing. I think too, on the resource front, I think we have to be better as Canadians at paying attention to how we fund any type of seniors facility. If you're going in there and you have several assets but pay on the basis of your income, is that fair? Should you be paying for services on the basis of both income and assets, so there are more dollars delivered to your facility in the delivery of that care. And I know we've got a mixture of public and private in delivery. In Alberta, I think we've probably been fortunate to just have Alberta Health Services rather than several regions like we had when I was the health minister. You've got a lot of voices, and it's just like talking across Canada to try and get everybody collaborative on the same page is a struggle. Added to that, and you heard it today, the municipalities have certainly struggled too, and many of them are part of the long-term supports for facilities, lodge facilities and other things, and they're struggling to make ends meet. So the challenges are huge, but here's my level of confidence. We're Canadians. We believe passionately in the system, and we're going to make a difference. And perhaps if there's a saving light here, it's that we have been given a huge wake-up call before our seniors population, the boomers, really take hold and double, and where we need more facilities and more supports for the things that happen in the future in long-term care.
Thank you, Iris. I want to move us on to talk about the different stages of care. So let me try and very simplistically divide into 3 stages. So seniors who live in their homes and want to live independently. The second would be retirement residences, and the third would be long-term care. So just talking about the seniors who live on their own and require some level of services, and I'll ask Vicki this because I think it's probably nurses who do this most, Victoria or Victoria Order of Nurses and others who visit people in their homes. How are we doing on that front?
I think we have a long way to go in Ontario around supplying services or providing services to seniors in their homes. Recently, I would say over the last few years, there's been more talk about community supports and supports for seniors who want to stay at home and should be able to stay at home. However, the services aren't there. So much of this, and I think Iris alluded to it, it's about it is about funding and priorities and what we want as Ontarians, as Canadians, and what the expectations are, but what they should be. And I know that we don't have the funding support in home care that we need. And even when new programs start up, the backlog of services in Ontario, with being able to provide those services is huge. And so many people who want to stay in their home and need even just maybe a little bit of help and sometimes a lot of help, getting access to those services is unattainable for them unless they have their own personal resources that will enable them to purchase more services, which is really unfortunate. I think as Ontarians, as Canadians, we have to make some serious decisions, and it is about policy, about what kind of funding and support we'll provide and what will be publicly funded and what otherwise is having to be privately purchased. And I think that we have opportunities to do some of those things right now, and as I think Iris talked about, is that the crisis that we have, the tragedy in long-term care, really have people focused on long-term care. However, I hope it isn't a fleeting focus, that people actually will have a serious discussions and policymakers. It will be about, yes, political will, but it will be about Canadians and Ontarians and what we're prepared to do and what we're prepared to talk about, inclusion in the Canada Healthcare Act, for instance, and what will be available to all Canadians. It's a really serious conversation, but home care is a really important part and underutilized.
And generally speaking, we're talking about either personal support workers and or nurses who visit people in their homes once a day or a couple of times a week. Is that kind of the range of things we're looking at?
Exactly. And it varies. It varies about what kind of assistance and support people might need in their homes. And this is many people who want to stay in their homes sometimes have some pretty complex medical issues, and you need registered nurses, registered practical nurses, and sometimes nurse practitioners involved in their care, and PSWs as well. Personal support workers are really invaluable In order to do that, then we have to have the proper infrastructure, certainly, but also the funding support to make that happen. And it's difficult. It's difficult.
Yeah.
And nurses who work in coordinating that care here in the province of Ontario talk to me about the backlog that they have of trying to address the needs of Ontarians.
And I think it's quite varied across the country as to what provinces provide in terms of staffing, but as well also in terms of infrastructure, whether people provide things like a hospital bed or other kinds of fixtures around a house to make it more accessible and safer. Those kinds of services and what gets covered varies across the country.
Absolutely.
Yeah, can I move, if you don't mind, move on to retirement residences? And that hasn't been much of the focus of discussion. But are we not dealing with the same level of issues in terms of part-time workers in retirement residences as we do in long-term care?
Yeah, I would say so. Certainly, it's a different levels of services that are provided in long-term care or in retirement facilities, for instance, because generally people are pretty much self-sufficient. They need additional services. They often have to purchase those, and then those are often done by part-time or contract workers that they bring in to provide those services. The impact in congregate living and retirement homes here in Ontario has been huge. And I think our numbers of people who have been infected with COVID-19, again, having the infrastructure, but also the policies and procedures and the administrative support and training in retirement homes. It's really putting a glaring light there as well, and what we need to protect the people that we care for. It's really, it really comes down to that.
Yeah, Donna Duncan, I know you represent the long-term care homes, but did you want to comment at all on the level of support that's provided in the retirement residences?
Yeah, and on home care as well, I would say it's,
Right.
A system is a group of interdependent components. We don't have any interdependence. We have siloed systems. So we see large disconnects between home care and retirement and long-term care and hospital care. We invest in what we value, and it's very clear that there's ageism at play where we have neglected all of the services that support our seniors, but whether they're healthcare services or social services, and how do we start connecting the dots in a much more structured and thoughtful way around the needs of the individuals who need care. And certainly we are seeing our demographic is aging in place and aging in home, whether it's your own home or in retirement, is profoundly important. That's an important choice and decision for those who have the luxury to do it and can. Certainly the reality is the level of care needs are so high. How do we make sure that we build care and supports around them and staff them, build the right staff and competencies around those home care and retirement care services, as well as in long-term care, and use that as the starting point, not the amount of money. Let's back up, make sure that we're building something in a really thoughtful way, and then look at the funding. But let's see what people and resources we need around it, whether it's more nurses or RPNs or nurse practitioners or other physician supports and other social supports. Certainly in retirement's more like a home care model, and in both retirement and home care during COVID-19, the challenge has been the very thing that Vicki talked about, is staff who work part-time, who move among multiple sites. So we've all shared employees among home care, retirement, and long-term care, and that's been a huge challenge for us, especially given the staffing resources. But in the home care side, so many families didn't want people coming into their homes. So there are individuals who are not getting care right now because they don't want someone to come in and potentially infect them in their home environment. So what does home care look like in a COVID pandemic over the next 12, 24 months and on an ongoing basis? So even as we think about what infection prevention and control looks like, to give people the comfort, to give staff the comfort that they know that they're safe, what are the tools and supports we need to put around our home care, retirement and long-term care staff, whether PSWs, nurses, or others, to make sure that they feel safe, and what other skills and competencies do we need and supports do we need to put around the employees so that they're not afraid and that they're willing to go to work. Because if our staff are safe and our employees and our professionals are safe, then the people we serve will feel safe and will feel that it's okay to get their supports. It is, the power of fear in this dynamic has created, myriad issues and risks, quite honestly, the risk of COVID versus risk of being harmed from something else.
Yeah, thank you. Iris?
Just a brief addition to what Vicki and Dawn have cited. One unintended consequence of the CERB was that the workers in our retirement residence chose not to go to work and to collect the CERB. And so immediately, to fulfill the obligations of the new health imposed orders on retirement facilities, we had a number of people who were no longer willing to come and who, as part-timers, said they'd rather collect the CERB, thank you very much. And that's happened to local businesses as well. But I think it would be an unintended consequence that the facilities that need that support would suddenly be struggling to find the right kind of support to fulfill the obligations that health issued with the orders. And I think that's of critical importance. The other thing, of course, has been the isolation in those residents as well, not only in homes, but in retirement residences where they were more accustomed to supports in the community for other kinds of things that they were no longer getting. And I'm hopeful that the next generation are so well equipped to Zoom and host party and everything like that, that we're able to give everybody the iPad or the access to talk to their families and to do something, because this time it was very obvious that it's been extremely difficult. So we have to build that into the plan for the future.
Yeah, I'd like to move on to, we had a couple more questions, but before we move on to where we go next and what the solutions are, Vicki or Donna, do you have any other observations you want to share about how conditions have been, or things, or how your role has been over the past 2 or 3 months?
Well, certainly for us, for myself, our whole organization really has focused on trying to ensure that the proper protective equipment was available to nurses. And we've had to, go to extraordinary avenues in order to do that, which is something unheard of. We had to, go to the Superior Court in Ontario in order to ensure that the government directives were complied with. We continue to move, at arbitration at labor boards on following the Ontario Chief Medical Officer's health directives to ensure that protective equipment is there. We're a lot of focus certainly on the current crisis that we're in, and ensuring nurses primarily have access to what they need to in order to care for the people that they're caring for. At the same time, we're also working, closely as we can with government at various tables, talking about and working with them on personal protective equipment, on what the emerging science is, looking at what we all need to do together in order to ensure that Ontarians are safe. So our focus has certainly been that, but at the same time, we're preparing and getting ready for policy work and talking, working with government what we expect to see that what all the focus has been and how we can bring what needs to change in Ontario, and change, do it quickly, yes, but also thoughtfully, and making sure that we have, the support. I think Ontarians certainly, and Canadians, I'm sure, eyes are on this. We're all isolated, now, so we're, really paying much more attention than maybe we would otherwise. But at the same time, as I said, I hope it's not a flash in the pan.
Okay, thank you, Don. Do you want to add anything?
Yeah, sure. I would say that the focus of our activities has been multifold. One, it's been a lot of education. It's been quite shocking, the lack of understanding about what long-term care is, who our residents are, what the complexity of their healthcare needs is like, what are staffing issues. We've been trying to shed a light on this for decades, and yet no one was in receive mode. And then COVID-19 comes and suddenly it's, oh my goodness, the horror. And which is tragic that it's taken this to open eyes. But even the notion that people are in long-term care because they choose to be there. They're there because they were in hospital, they couldn't go home because their care needs were so high that they couldn't be supported in their home environment. And yet, I'm shocked at public opinion leaders in the media and indeed even in hospitals where they had no appreciation for who our residents are and what their needs are. And it's very, very clear that the homes and the staffing models and the service models, quite honestly, were not built for this resident population. And our legislative framework is stuck in time. And in fact, it's so prescriptive, our nurses couldn't work to full scope of practice, and in many cases wouldn't be able to implement their full pandemic plan. We need to step back and really look at where quality fits in this, and starting to educate people around what is that tension between care and a home, and really try to balance that, because hospitals coming into long-term care would come in and say, oh my goodness, you have upholstered furniture, there's a rug here, there are personal belongings here, you can't have that, that's counter to infection prevention and control. So we have a bigger discussion to have, as Vicki says, around what is long-term care, how do we build it, what is that continuum, how do we staff it and resource it, and build it from the resident and family needs up, and not from, here's a funny model, squeeze what you can out of it. So that education piece has been really, really important for us. Try to get out of, everything that we're seeing is happening as homes went into crisis, the need for stabilization, a lot of interpretation of various orders and directives, which could change almost daily through this. The guidance today is not what the guidance was when this started. So things have been shifting in real time, trying to understand, I think to the point about different levels of government or different levels of the people in the healthcare system interpreting things differently, where was consistency in this. So just trying to find a way about what is the direction, what are we supposed to be doing, and that has really evolved as we learned more about COVID-19, including asymptomatic spread. The other piece that we never thought as an association we would be into is we actually launched a job matching portal in partnership with Seneca College and TazWiz, a company from Seneca's incubator, where we have 1,000 registrants across Ontario as we're trying to build a workforce in real time, because we know that these are other temporary measures. So those are things, that's certainly a line of business we never anticipated, but just the policy work. And I would say one thing that we found through this is, as directives came down, they were never always put through the filter of, and how do you operationalize this guidance? How do you operationalize the directive? And so let's not have a disconnect as we go forward between the directives and what you can actually do. And I think, especially when PPE was so scarce in the beginning, issuing directives that we couldn't comply with, and based on science and disputed science, there's lots of debate going on while we're trying to save lives. I think this has been an uneasy dance for everybody in terms of learning how to get through this, but I would hope that these relationships will continue and we'll find our way through.
Okay, can I move to one of the bigger ideas that has been out there about where we go next? And one of them is certainly to move long-term care under the Canada Health Act. Can I ask you what you think about that and what that would accomplish? Vicki McKenna, I'll ask you that first.
Well, certainly there's been lots of discussion about that for some time, and it's certainly in the amongst nursing colleagues across the country, talking about the rising need for there to be the appropriate care in long-term care. And as the boomer generation, all of that is happening, how do we really respond to that? what we see is such an inequity and differences in services across this country. And certainly when you ask Canadians, when you ask members of the public, you know, what their expectations are, they expect that they will be cared for. And I do too. And I think that we need to really have a serious conversation about it, but we won't actually, that will never happen unless there is a move to bring it under the Canadian Healthcare Act. It won't happen unless we do that. And we have to set standards. We cannot just, you know, open a door without there being a high level of regulation. And I know regulation is a hot topic for many. Many believe we have too much regulation. And I would say we can't have this service, we can't be providing services without regulation in order to ensure standards are maintained. It's absolutely true. And we need it. We would like to see it under the Canada Healthcare Act. And yes, it's about resources and taxes and many of those obligations that we would have in order to have a public service such as that. But I think that I myself and many of my colleagues across this country believe that the Canada Healthcare Act should include long-term care and home care. But certainly this is something that's reared its head, and I think it's a hopeful conversation that will happen. And certainly if there's, it will come from the public, it will come from the Canadians and from people. If they want this, then our government should move in that direction.
Okay, Iris Evans, your thoughts about moving long-term care under the Canada Health Act?
Do you know, I'm going to give you a different perception. The most popular politician is the local politician, and that's because you can get your hands on that person. And the further removed you are from the people that elect you, the less likely you are to be able to have that kind of relationship. So from my 33 years experience, this is my opportunity to tell you this. Healthcare comes into the room when cabinets discuss budgets, and at provincial levels, it's almost 50%, if not more, than the provincial budget. So it gets pretty rigorous scrutiny. The federal budget for healthcare addresses Canada Health Insurance, the Canadian health transfers. And if you withhold dollars, those dollars have to come from somewhere to fund such an activity at the Canadian level. You may achieve a pan-Canadian hierarchy, but then who has the ability to govern that when public health goes wrong? I mean, this time in our history, we've heard more from the Canada health perspective than we have usually, because the provinces under the Canadian Constitution are responsible. And so it really worries me that it may not solve the problem you're trying to solve. Number one, I should be responsible for my own health plan. Number two, the boomers better get busy and define a health plan and have some ownership to it. And number three, we've got to be willing to share data, best practices, what worked, what didn't work during this particular period, because I think it's going to be the conversations between Vicky and Donna that will generate the most improvement, quite frankly, because every time you give it to another political hierarchy with the hope it's done, my corporations won't give me another dime for these retirement residences. They're already saying, no, those are taxpayer responsibilities. And I don't want corporates or individuals to feel that, oh, well, Prime Minister Trudeau has to look after that. That's the Canada Health Act. You've got to bring it home so that mom and dad know that they're responsible. It's my view.
Okay, thank you. Donna Duncan, your thoughts about the Canada Health Act?
Again, I would echo Iris. What is the problem we're actually trying to solve? And I always worry that we're conflating the Canada Health Act with the healthcare system and interdependence. So the Canada Health Act, is guided by its 5 principles, which it's a 14-page piece of legislation. So it's not as prescriptive as others might think. I had somebody today tell me they thought it was 1,200 pages, and I said, no, it's 14, bilingual. And so You know, I would actually argue that one of the principles that we need isn't in it, and that's accountability, and that's our collective and shared accountability for how we're going to challenge each other's to come forward. You know, the federal government can participate in many ways in long-term care and the healthcare system. I had the privilege of participating in consultations in 2016 when the government was negotiating the bilateral healthcare accords with the various provinces, where through that process they actually dedicated funds specifically to mental health and home care. Not long-term care was not part of it, but home care and mental health were. And those are, I think, to Vicky's point, also not captured by the Canada Health Act. So what is it we're trying to solve, and how do we actually look at system integration and integrative care models? And in my mind, that's where the work is to be done. Certainly every province has a lot of work to do in that regard. I'm not sure we need to blow up federalism in order to do that. There's urgency right now. We need to act. We actually can look at making sure that the federal government keeps the supply chain open for personal protective equipment, that the federal government's working to get rapid tests approved and mobilized and deployed across the country as quickly as possible, that the federal government can look at that health accord funding, as well as infrastructure, both interim infrastructure. So for instance, in Ontario, if the direction is that we will no longer have 4 people in a room, and we reduce those that occupancy by 2 for all those rooms, we will be taking out 10,000 long-term care beds out of the province of Ontario in very short order. So then what does that mean in terms of home care, retirement care, and perhaps even temporary accommodation that's going to have to be built? And then we have to get our infrastructure built for the longer term and figure out what that actually needs to look like. So those are roles certainly where I think the federal government can step in quite seamlessly already.
Okay, let me move to some of the questions we've had, and we've had a number. I'm going to try and summarize them and combine a few questions. So there have been a few questions around funding, funding being one of the major cures that would be necessary, if I can use that term. So one of the questions is the systemic sexism and racism in our healthcare system, especially seniors care, has become clear during this COVID period. How can we overcome that? And I guess it's referring to the fact that a lot of the people working in the most precarious positions are women and racial minorities. How can we overcome that with either better pair full-time positions or job security? Vicky, would you like to start with that?
Well, certainly what you said is true. It's certainly a female-dominated profession, no doubt about it. But certainly what we see is marginalized workers and that high number of racialized and immigrant workers working in long-term care, particularly in the nursing profession and as well as in the support services. And it's precarious employment, some of the most precarious employment out there, with you know, job security that is certainly not certain in many cases, and also the equity in the payment for healthcare professionals and for support services all around. You know, I remember one of my instructors always said to me, like, follow the money. You know, where is the importance and where are the priorities for society? Is you follow the money and where the investments are. And it hasn't been in long-term care. Absolutely. I mean, this is not a new concept. We've just come out of a long-term care inquiry report last summer that detailed many of these situations around the staffing issue, around training, around administrative support. Many things were outlined there. And that was not the first time, but that was just the most recent. There's been many studies done in Ontario in particular, and probably across the country, but more familiar here, about what it is that we need to do to stabilize the workforce. How can we entice people to come and work in long-term care? And you know, what do we need in order to do that? And for the residents around quality, what do we need to do so that these, you know, in nursing homes in particular, these are their homes. This is where people live. And we need to treat it as that, and that does take concerted not only effort but investment in order to make that happen. We need to ensure that people have available to them what they should in their home, and it is their homes, whether it's a nursing home, retirement home, a home for the aged. This is where people are living, and they deserve to be treated as such. But for the workers, absolutely, is that they need stability in their work, and they need to be recognized, and not to be, often they will tell me they feel like the poor cousins working in long-term care, that they're forgotten workers. And the nurses themselves tell, even amongst their colleagues, and this is something work we've been doing, is to heighten and to ensure that people, value the work that's done in long-term care. And there is, in the value piece of this is critically important. There's culture issues right across healthcare in regard to how long-term care is viewed. And that is, to me, has always been very sad and totally something that we all have a responsibility to do.
Yeah.
But certainly racism and just, is a huge issue. It is absolutely true. And I think it's a real problem that we need to deal with.
Yeah, it's like we just accept that that's a profession where women are working and minorities are working, and they should be happy with that level of pay.
Yeah, and I should just say,
because I can't, that's not right.
Right, I can't help myself but to tell you, we've been in a 13-year battle for pay equity in Ontario for nurses working in long-term care. And these are nurses who are working in the for-profit sector. 13-year battle. We just finally came through a tribunal, which now we're into another appeal situation with. The government's involved in it as well. But pay equity, you'd think that in 2020 we wouldn't be fighting pay equity, but we are. We're fighting pay equity still in this province.
Donna, certainly money is a major issue here. Should the provinces not be putting in more? Should the feds be putting in money? Is there something else we shouldn't be covering?
And unfortunately, we have to make choices, and how big's the pie, but what do we value? I think to Vicky's point, if we value our seniors, then we will prioritize and invest in our seniors, and we will make sure that they have the support and resources around them. I think we owe it to them. Do we value the people who built our country? Do we value the people who have fought for our country, who have raised their families, who have built these communities? And I do believe that we have to have some very large discussions among the various levels of government, as well as where the private sector participates as well. And certainly we've had lots of discussion around how they build infrastructure in different provinces, and how they partner in building hospitals and other buildings as well. Somehow we have to build a long-term care sector, but a seniors care sector that is founded on our values, including the people we value, but supports morale. The morale in long-term care right now, it couldn't be worse. And in very short order, if we're trying to build an army around these homes right now, we're having people quit daily because they are, the stigma of working in long-term care it's just escalated right now, where the entire sector and every home and every employee is now being painted with this brush that they are bad. And we got to find a way to collectively at all levels of government and across the sectors and with our labor and other partners to turn a corner on that as quickly as possible, because our seniors need help. But if you're seen as being the devil and stigmatized and not being supported, not having the tools that you need in terms of the PPE or the training and support, and all of the resources that go around that, and making sure that you're in a well-resourced and funded sector in an environment that is safe. We need to change that, and we need to start making that change now, because it's unacceptable.
In terms of reputation, one of the questions is also, just as staff are feeling the pressure, are you sensing from seniors that they are less are more reluctant to come and live in seniors' homes after having heard everything over the last few months. Maybe I'll start with you, Iris.
Oh, I think so. I mean, that is the conversation. Where do we go that it's safe?
Yeah.
How can you be sure that the standards are met? It's interesting, our Health Quality Council every year surveys over 7,000 people who are family members of people in care. And they talk about the level of staffing and they talk about the food. You know, it's interesting the things that people look at, but there's been a real fear about it. Are we providing enough? But let me get back to the question about inclusion and diversification. Canadians have to take a good, serious look at what's happening with the neighbors south of the border and see whether we can become a more tolerant, inclusive society at every level, whether it's immigrant care workers, whoever it is, because we do not want to be branded with a racist and a most tragic brand of intolerance for other races and other members that are Canadian just like we are. And I really hope one of our periods of growth in the next few months is being more racially tolerant and inclusive. It's got tragic consequences in nursing or in every other profession.
Yeah. Vicki, did you want to comment on that?
Well, I agree. We absolutely have to be very clear about that we will not tolerate that kind of, the racism and I am very worried about, just like you, Iris, what I hear about, and people, it's becoming licensed or normalized in some sense on through some media channels, and certainly comments made by politicians who a politician that I'm not going to name that seem to give people license to behave in such ways. And it's shocking that it's happening, and I certain people need to stand up and say this is not okay, and we cannot let this go on. And certainly we need to not say, well, it's just happening down there. Well, I can tell you that racism is alive and well, and unfortunately so. And we all have a role to play in not allowing it to become more pervasive, and we have to fight back and not let it happen. And we have to be very clear about it, not just silent, and we have to speak out.
And Vicki, in terms of the reputation of living in a senior's home, whether it's long-term care or others, are you finding any increased reluctance of people to move to seniors' homes? There's always a level of reluctance for seniors to move into a home. Is that going to increase now?
Well, I'm afraid, I don't know personally how much that is happening. I'm hearing from nurses who work in the sector themselves, and hearing from family members who are saying, I wish we'd never brought mom here. I wish, that they're afraid. The public is afraid, and we'll have to do everything we can to restore confidence in that, for sure. But yes, I think the military report certainly, came out, and it is shocking and horrific. But to many people, not surprised, because many of us in the system knew there were trouble and problems for some time now. However, I do think that the public, I'm worried about their perception, because we have some excellent facilities. We really do, but we have problems, and we need to correct those. But we need to be able to tell people with confidence that they will be safe. And that will require a lot of work, but also it will require stabilization in the staffing side of it, for sure, and the facility side of it.
Yeah, and in some ways the timing couldn't be worse, because we've got an aging society, but in a very cruel way, it's probably not so bad, because this is the tragic wake-up call that we're getting, that we need to fix it for what's got to come in terms of the aging population. We've run out of time. We've covered some of the questions. I apologize to those who we haven't. I think we need to do another webinar on this topic, delving a little more deeply on some of the issues. But I will ask our three guests for a closing comment for about 1 minute each. Vicki McKenna, you first, then Donna Duncan, and then Iris Evans. So Vicki, please go ahead.
Thank you, Andrew. What I'd like to say for those that are listening on the webinar is that long-term care, I'm hoping that, as I said, that this will not just be flash in the pan, that it's in, it's out in the press now, people are thinking about it, but I really hope people will engage in thinking about long-term care and thinking about what supports are needed and participate in public, might be town hall meetings, on webinars, letting their MPPs in Ontario know how important long-term care is, and that the government's eyes need to be on it, and that we do need proof, and that it needs to be there for all of us in the future, probably, but at least the people that come after us will say, they took it by the reins and they did something that actually made a difference. That's what I want to be a part of.
Thank you. Donna Duncan?
Thank you very much to everybody for participating today, and it's been, again, a real privilege to be able to participate. Just to echo Vicky's comments, this is a moment in time that we need to seize, that we need to recognize as the call to rally around long-term care, to come together across all levels of government, across the healthcare sector, our social services, engaging with families, residents, and our labor partners. Everybody needs to come together. We need to have a shared vision for what we're committed to doing to make things better for our seniors and those who support them, those frontline heroes. But we can't squander time. There are things we actually have to do now. We're in the midst of a pandemic. We still have another potential year or more ahead of us. So let's not lose sight of that and become complacent. We need people to continue to social distance, but we need that PPE. We need the testing and focus and prioritization of our seniors for those supports. We need to build a workforce today or yesterday and make sure that we're supporting them and validating them and keeping them safe so that they can keep our residents safe. This is the moment, and we need capital improvements so that we can manage infection prevention and control. We need to better work with our physicians and our medical directors. There's a lot that has to happen now, and we can't lose sight of that. So we can reflect, but we have to act.
Thank you, Donna. Iris Evans.
And take the time, both as individuals, to plan for ourselves and to make a contribution in our community to the kinds of policies that we can be proud of. To the kinds of policies our grandchildren will say they made that difference then. Made a difference. And really put the pedal to the metal on this one. Stay well, and thank you, everyone. It was a great privilege.
Yes, thank you very much. It was a privilege. Thank you.
Thank you very much, Vicki McKenna, Donna Duncan, and Iris Evans. This has been a very interesting discussion. You've certainly answered a lot of questions. There's lots of other things to discuss. I want to thank the audience for your questions. They will help formulate the next session that we have, which we really need to do. As Francesca mentioned at the beginning, we plan to be doing more study on this over the next 3 or 4 months over the summer and issue a short report at the end of summer with some key recommendations. I want to remind you that we have several more webinars over the summer. Next week, we will have one on the tourism and travel industry on June the 10th. And then we'll have one on racism and COVID, likely the end of the week. So thank you to all of you for your participation, and we look forward to seeing you again. All the best. And if I can remind you, wash your hands, keep your mask on, and keep your distance. Bye. Thank you.
Thank you.